I think we can get started now. Thank you everyone for joining us for our last talk today, and thank you everyone for being so supportive of our mission today to help women reconnect with their bodies. And thank you for bringing your male partners here as well and participating. Today's last talk we have with Kunmon Nisha. We have the first U.S. licensed naturopathic doctor here in Thailand, and she has opened her clinic, Niche Health Clinic, since 2016, correct? Kunmon Nisha, do you want to give us a little bit of a background about how you became a naturopathic doctor?
Yeah, thank you for having me, first of all, and thank everyone for joining today. Let me introduce myself first. My name is Dr. Nisha, and I am a naturopathic doctor. For those who are not familiar with naturopathic medicine, so we focus on using natural medicine, natural treatment whenever possible, and reduce the need of using pharmaceutical drug and surgery when we can. Yeah. So basically, my focus, I mainly focus a lot on women's health, hormonal health, immune health, so including allergy and autoimmune. Those are my main focus, clinical focus.
Hormonal health, and I'm sure everyone here has their own journey with that, because it starts from the first day you get your period to the last day before you go into menopause. You can have so many different worries and concerns over that. So one of the issues that we actually spoke about in the last talk as well is that this month is Endometriosis Awareness Month. And I've heard that endometriosis takes on average 10 years to get a diagnosis. And I also learned that you also went through endometriosis yourself. Can you tell us a little bit about your story?
Yeah, it's going to be a long story though, but I'm going to make it short for everyone. Okay, so I myself have been diagnosed as endometriosis since I was about 16, 17. So back then I didn't know what it was, but I had a really, really bad menstrual cramp every month, and it's getting worse and worse.
Can I ask?
How bad? Or
yeah, how bad? Because pain is so subjective.
Yeah,
so.
yeah. Okay. So how bad? You know how everyone is normalizing women having pain or having cramp is something normal. That but level of discomfort or level of pain is so subjective, like you said. In my case, I couldn't go to school. I had to take a day off. I had to take about like 10 pills in one day on my first day to survive.
This was every month?
Every month, yeah. Okay. So it's pretty much a day off, laying in bed and take a lot of medicine. Yeah, so that was how bad.
And then when did you decide to seek help?
When I was 17, I was in high school in Canada, and I called my mom. Mom, I think this is getting unbearable. I don't think I could survive. Like, I can't do anything. It's getting worse and worse. I think we need to do something. So I went back home in Thailand, and I went to see a doctor, and we had an exam and all the testing and everything, and I was diagnosed as endometriosis. The first thing the doctor said to me, if you want to get rid of it permanently, you should get pregnant. And I was 17. Okay, no, thank you. Okay, so what another option? Do I have any option? So he said, okay, if not pregnancy, then we should get a surgery. Yeah, to kind of clear thing off.
So you got the surgery?
I did, and I thought that was the end of it, but it's not. So, right after the surgery, I've been told that I have to take the hormone for another 2 years, form of oral pill and also injection, hormonal injection. So I did that for 2 years, and then the doctor in Canada told me that we need to stop what you're doing right now because the side effect could be too much, and the body can't tolerate it, and you should stop doing the hormonal treatment. And I asked, what do I have to do then? The doctor told me, okay, you don't have to do anything. If the symptoms come back, then we figure out what to do again.
And it did come back.
And yeah, so I stopped all the treatment, And about not even a year, it started to come back. Yeah.
That must be so frustrating to
Yeah.
go to the doctor seeking help and trying to take control of your health by being an advocate, but also not getting a sustainable treatment plan. So can I ask, what else did you have to do to alleviate the symptoms?
Yeah. So after that, I feel like, it's kind of the end of the world. I was about 20, 21 back then. So I went through 3 years of treatment, and I have to stop, and then I start getting the symptom back again. So I started reading a book about endometriosis. I read all the book available on Amazon at that time. I order everything, I read it, and then I found about the alternative treatment. So the diet, the lifestyle, naturopathic medicine. So I kind of went to OB/GYN and asked if I should do any of these, and he said, you have nothing to lose, you might have to try. Yeah.
So trial and error.
Yeah, kind of. But he didn't really believe it. He's like, why not? Because we don't have anything to offer you right now. So you do whatever you want.
So can I ask, how is your journey with endometriosis today?
Yeah. So now, every time that I have my menstrual period, I don't have to take any pill. Maybe a maximum of one,
And by pill, you mean?
a painkiller.
Okay.
Sorry. Yeah. And daily activity wise, I'm able to do whatever I need to do. I can go to work, I can go to Pilates, yoga, anything I want to do. I might have some discomfort, but definitely not pain. Yeah.
So that's a long journey to be going and suffering through endometriosis. Why is it such that the female hormones is so complex and complicated? Do you find that to be the case, or is it just a lack of information, lack of education?
Yeah, I think first of all, lack of information, lack of education. When I was a patient myself, I did not have any information or education. I rely on the doctor for any decision that I made for myself, which is wrong, which is really bad. I have to have enough information to make a decision for myself. Yeah. So if I could turn back time, I would not go through everything again at all. If I know what is the side effect of it, what the pro and the con.
So what are the key female hormones should we learn about, and which ones should we focus on?
Yeah. So two main female hormone are estrogen and progesterone. Okay. So these are the big thing, and these are the two things that make everyone have the healthy menstrual period or an unhealthy one. So in my case, I had too much of the estrogen and not enough of the progesterone, and that stimulate the lining in the uterus to grow. But it's part of it is genetic too, that it started to grow outside. So that's why we call it endometriosis.
So I think one of the most, I would hypothesize that one of the most Googled questions that women like to type in is this normal? Like, is my pain normal? Is my irregular period, is my hormones, whatever it is it normal? But how do we find that balance between needing to seek help and learning by yourself and finding that balance?
Yeah. So I am the person who has experienced, the whole spectrum from being pain-free to being in extreme pain. So I don't think any pain should be seen as normal. First of all, it's a sign that the body is trying to tell us that something wrong, so we feel the pain, right? So the maximum that you should feel, that any woman should feel, is discomfort. But it should not stop you from doing any activity. Yeah. So that would be by my definition of the normal discomfort during the period.
Definitely don't suffer through it alone and seek help. For me, I when I started tracking my own fertility, tracking my key fertile signs, my cervical mucus, my basal body temperature, and my period, I realized that it's another another data point about your health. So a lot of people say that your menstrual cycle is like a fifth vital sign, kind of like your temperature. So when you track your cycles, you can show this to the doctor, right? You should be able to show this is my cycle patterns, and the doctor should be able to give you more information about your health. Do you see that as a valuable insight for a woman's health by tracking their cycles?
Super valuable. I get very frustrated every time I ask my patient, when was their last menstrual period? And they went blank on me.
They don't know.
No, I don't remember. So that should be that should not happen. Everyone should be aware of what's going on in your body. When did you start bleeding? When did you stop bleeding? Anything look different from your last cycle? Any PMS symptom, anything that seems to be abnormal. Otherwise, I always tell everyone at the Toad Compare that I believe that you yourself are the best doctor for yourself. Okay, there's no best doctor in the world other than yourself, because you are the one who know what's going on inside. You are the only one who are able to observe, every little thing. And the doctor is just the person who analyzes the information that you observe. So I think it's really, really important. Doctor, play one part, but your part, your compliance is very helpful.
So trust your instincts and trust your gut.
Yes.
And this was the whole premise of having this event, is to be able to trust more about what your body's telling you. Like, it's screaming pain, listen to it, right? So I think one of the misconceptions that people have about the pill, would you want to share a little bit more about the birth control pill?
Sure. Yep. What's the question?
So I've been told that this is a little confusing, but some people say that the birth control pill helps regulate the cycle. But do you think it regulates the cycle, or is this just a myth?
Okay. Since I'm a naturopathic doctor, I believe in natural medicine. So I feel like by putting the external hormone into our bodies is something unnatural. Okay. So first of all, our body is like the factory. It's got a machine that produces the hormone. So we produce estrogen, we produce progesterone. But once we start taking the hormone from outside, the body is so smart, it just, I got all the hormone from outside, I don't need to produce anymore. Otherwise, it's going to be too much, right? So it stopped production. It stopped the production. So what happened is, once we take off the birth control pill, and we think our body will come back and work again like nothing happened, you're wrong. Because once the machine shut off for a long time, you can't just turn it on and expect it to work like before, like 100%. Yeah, so that's what happened.
What about the, women still bleed when they're on the pill, so they still have that monthly bleed by the sugar pill, I believe it's called, and they have this withdrawal bleed. Is that a real period?
It is a real period, but it's not the real hormone that we make. The hormone that we make inside and the hormone that we take from the pill, it does the same job, but it does not look exactly the same. Okay? If you look at molecule to molecule, it looks different. And so it's something that's foreign to our bodies. Yeah.
Statement that I've been told before is that the pill kind of biologically and chemically, it acts like putting your body through a state of menopause. And with the word menopause, a lot of people think like, oh my God, that's old age. I'm old now, like my life is over because it's menopause, but that's not always the case either. But does the pill act that way in the body?
I think so. I think so. The reason that I say I think so is I got a lot of cases who come to me 36-something years old, 41 years old. So young, they should not have any menopause, right? Not nothing near menopause. But yes, it is in an early menopause. And what happens if you take the birth control pill for so long, 3 years, 5 years, 10 years, your body stops all the production. And it's pretty much like when you're on menopause. You know, menopause means your body doesn't make any estrogen, doesn't make any progesterone, or make in very little amount. It's pretty much the same state. Yeah. So no wonder you take off the birth control pill after 5 years, 10 years, and you feel like you're menopausing.
Yeah. Well, I think a lot of women, including myself, is that you are taught that you can just go on the pill and you can come off it and everything will go back to normal. And if you're trying to conceive, if you're trying to have a baby, then you can just instantly start trying. But as you're saying, that's not always the case. So there's a period of time when after you come off the pill, you have to kind of prep your body and restore the health.
I would say for healthy people, about 3 months. You know, for someone who haven't been taking the birth control pill for too long, it takes about 3 months to adjust back to normal. But sadly, about 80% of the women that I see, they never really come back to normal. And when we test the hormone, the estrogen and progesterone, we see the level really low. You know. So that's why we think it's pretty much like a menopause. Yeah. And, you know, menopause stage, you can't have the baby, of course.
So a little bit about my story with the pill is that I was prescribed the pill in New York when I had irregular periods my whole life, well, until I was 21. And then I was prescribed the pill because my doctor told me it would regulate my cycle. And when I learned all this information about the pill and what potential side effects it could have, I decided to come off it. And then I started tracking my cycle. And it took me 9 months to start ovulating again. So I tracked ovulation and I found out that your body takes a long time to adjust back to producing the natural hormones regularly, for estrogen and progesterone, and you just have to give your body patience, right?
Yeah, and in some cases, it never go back to normal. I've seen some patients who came off like 3 years ago, and they still don't have the normal hormone level, and that's when I have to come and help them to get back to normal first.
So I think we might be scaring everyone off contraception and the pill right now, but I mean, it does have its benefits, right? And can you talk a little bit more about what kind of natural processes of coming off birth control, any natural treatments or lifestyle changes they can make?
Yeah, so usually once they come off, I wait for about 3 months until I test for the sex hormone level again. So, and then I use that at the baseline to see what we have to fix. Do we have to boost a little bit of the estrogen production, or do we have to boost the progesterone production, you know, to make sure that it all balances? And not only that, some people have problem with testosterone level as well, which is the male hormone. Not just the men that have the testosterone hormone. All women here, we do have testosterone level as well, and it's really important to keep it in shape, gain the muscle, and you know, all that. But anyway, I take the baseline first and I see what do I have to fix, and I will use like botanical herb or nutraceutical vitamin, like all the, let's say, the ingredient that the body needs to produce that exact hormone. And then once the body is able to produce again and come back to normal, then we take off the supplement and then we maintain with the lifestyle. Yeah.
You mentioned estrogen, testosterone, and progesterone as the key hormones. Could you talk about a little bit about the roles of the different hormones and the roles and the benefits of them all?
Okay. So when we talk about hormone, the tricky thing is like a spider web. When you pull one side, the whole thing kind of get moved as well. Okay, so it's really important to have the balance of all the hormones. Even if one hormone started to get imbalanced, then you know, after a while everything else will get imbalanced as well. So all the hormones are really important. So when we talk about estrogen, progesterone, and testosterone, so estrogen is the key hormone that make me feel, like woman, okay, that had like all the regular period, all the nice skin, all the nice hair, healthy bone, and able to conceive, able to have a baby. We need that estrogen. Okay, and progesterone is another hormone that we need to balance out as well. If you look at the graph of the hormone, we will see that we have different level of estrogen and progesterone every day. So it kind of some part of the month, some days in the month, the progesterone might be higher, estrogen might be lower. Okay, and some days it might be vice versa. So every day is different for women. So progesterone play a big part too. If we don't have enough progesterone, what happens if the mood swing get really bad? You might get kind of irritable or low mood, depression come really easily with low progesterone. And also sex drive, another part, and also all the PMS symptoms. If it's unbalanced, then it will be more of the problem as well. Yeah.
Now it makes so much sense because confession, I'm about to get my period, and I know that a lot of people on the Dragonfly team has their period, and we were just talking about cycle syncing in the previous talk, and I think a lot of women in here are cycle syncing right now, so apologize in advance if any of us get irritated and snap at people, because it does happen, but it's understandable because we go through cyclical changes throughout the whole month, and if it's imbalanced, then sometimes it's just understanding each other and being more patient with each other. Yeah. So apologies in advance.
Yeah.
So when it comes to dietary and lifestyle changes, nutrition, let's talk about that. What are the key changes do you think we have to make about nutrition for hormonal balance?
Okay. Let me tell you a story about myself. 20 years ago or so, 10-ish years ago, long time ago. So I was a person that I would call myself a very bad patient, if I have to describe.
A bad patient?
A bad patient.
I'm a bad patient too.
I ate very unhealthy, the standard American diet. Sandwiches, cheese, all the fried food, a lot of coffee with milk and syrup, okay, a lot of sugar, all the bad stuff that I'm not eating today. But back then, when I went to see a naturopathic doctor for myself with the endometriosis, the first thing that he asked me to change was my diet. So he asked me first, stop all the sugar, all the sugary stuff, all the added sugar, can you stop? I'm like, wow, I'm having caramel macchiato like 5 cups a day. Do I have to stop that? Yeah. So that was the first thing that I had to give up, so sugar.
What about natural sugar from fruits? Is that, should we stop that too?
Even from the whole food, let's say if you eat fruit or it's kind of sweet from the carbohydrate content, then it's fine, as long as it's not processed, it's not added sugar. But if it's something like added sugar, then it counts as the sugar.
What about juice? Because I know that's a huge part of the standard American diet too.
Well, I don't, when we talk about whole food, I don't see juice as whole food because, you take all the fiber out and it's just kind of a sugary content with some vitamin, with may or maybe not there. When we talk about juice, and if you want the benefit of having the juice, you should mix about 80% of the vegetable juice and 20% of the fruit juice. And then that used to have the benefit. Otherwise, it's going to be too sugary.
Okay. Yeah. So sugar. And I think a lot of the times, it's quite confusing as a consumer. Like you go grocery shopping and I try to look at the sugar in the nutritional value, but it's tricky because sometimes it's trigger for the portion size, and people always forget to look at the portion size. Sometimes a juice it says 8 grams of sugar, but it is for 4 portions of sugar. So if you multiply that, it's 32 grams of sugar within that drink. And I don't know about anyone, but I don't drink my juice in portions of that's
Exactly.
that's
We drink
recommended.
the whole thing.
Yeah, you drink the whole thing, you chug it down, and that's the same for a lot of packaged food because you don't eat it according to the portion. So it's a little tricky to navigate that as well.
Yeah, I think it's come to education as well, the awareness about what you're eating. We gotta be smarter than the marketing people. You know, they're trying to get away with the label and stuff, but if we have more awareness and be aware of what we're taking in, then I think that would not be a problem. Yeah.
So sugar is a key thing. I think we all can agree with
so
that
I
one.
challenge you, if any one of you have like a very bad PMS or going through any hormonal imbalance symptom, I challenge you to stop sugar for 14 days and 2 weeks, and see it yourself.
So if you're craving sugar right before your period,
Uh-huh.
is it just willpower, pure willpower that stops you from eating sugar? Or is there any treatment or any substitutes you can have for your
Well,
cravings?
I would rather have like fruit, go eat apple, orange, or whatever you can get a hand on. But definitely you don't go for a cake or bubble tea, or you gotta have enough willpower to stop it, and then you thank yourself for it. I myself, I never fully recovered from endometriosis because part of it is genetic. The only way that I can control the pain every month is I control what I eat. So if I eat a lot of sugar, then next month I know I will have a really, really bad cramp. Yeah.
Your body will remind you.
Yeah, my body is, it's so reactive.
Yeah, your body is sensitive to these things, and if you listen to it, then you'll understand.
Yeah.
And what about? So we talked about sugar. Is there anything else that we could easily avoid?
Yes. So definitely anything that create the inflammation in the body. So think about processed food, and that's a key thing as well. So processed food, the one that's anything that's not fresh, anything that's not whole, anything that had been processed or deep fried. So those are pretty bad for hormonal, stabilizing the hormone. Yeah.
And what about containers like plastic, styrofoam, all these containers that we use so heavily, and especially during COVID times when we order so much delivery to their homes, everything's packed in plastic.
Yeah.
Does that have any effect on our hormones?
Definitely a lot of effect. So that's a big thing that I wanted to talk about as well. So the environmental toxin or any toxin that you put into your body disrupt the hormone. So plastic is known as the endocrine disrupting chemical. So they contain all those kind of things. So nowadays I change everything that I use, all of my personal care, skincare to organic, because any chemical that you use on your skin or taking in or applying your body, they will go in and disrupt your hormone, and that's the cause of hormone imbalance. We see a lot of problems these days, and part of it because of this stuff.
So when you say these chemicals, is there any other chemicals aside from plastic that we should look out for?
Pretty much all the chemical. So when you go to when you buy your skincare, you will see that they have like 7 chemical free or 10 free. So all those chemicals have known to disrupt the hormone one or the other way.
They're just out to get us.
So yeah, all the makeup, the shampoo. So there was one study that kind of look at how many products we women use. So on average, we use about 25 products on our body. So think about it: skincare, hair, everything, makeup, and everything. There's a lot of product, and think about how much chemical can accumulate inside your body.
So this accumulation of chemicals, we cannot, living in Thailand, breathing this air quality, we cannot avoid all these chemicals. Are there any ways that you can recommend for detoxing these chemicals?
So one way to help the body is to make sure that you have enough antioxidant. So all the chemicals, they are free radical, and we want to have enough antioxidant to kind of reduce the effect of it. Doesn't mean that it will cancel out 100%, but it will definitely help, and your body will need a lot of it to get rid of it. Okay, and make sure that the liver is working well, because liver is going to be the main organ that has to detoxify all of these chemicals. Yeah, and when I say take care of your liver, so first of all, alcohol, we all know. So, so when we drink alcohol, the liver is kind of busy taking care of getting rid of alcohol out of your body, so it doesn't have any other capacity to take out any other chemical. So alcohol is definitely one of the killer for the liver. And also, if we can eat stuff that kind of take care of the liver, so all the antioxidant, the cruciferous vegetable like broccoli, what else?
Cruciferous vegetables.
Yeah. The Brussels sprout, all those stuff.
The white broccoli, what's that called? Cauliflower.
Cauliflower, yeah. So all those things are really good for liver and known to help detoxify.
Okay.
Yeah.
What about, so that's for dietary. Is there any lifestyle changes you can do to detox?
A lot. For detox, definitely hydration.
Okay.
So if we think about how we can take bad stuff out of the body is through the urine, to the bowel movement, to the stool, and to the sweat. So 3 things that I highly recommended you all to do: drink enough water so it can flush the toxin out, have enough fiber, so you make sure you have regular bowel movement. If you have constipation, that means your body takes all the toxin back into the system. Okay, you kind of absorb them back in, so never constipate. Okay? And third, make sure that you sweat every day. So if you exercise or go for a walk, it's so easy to sweat in Thailand. So make sure that you sweat a lot. That's another way to get rid of the toxin.
So I'm sure everyone here who has joined the workshops, been out in this heat, has benefited from this detoxing as well. Another thing I wanted to touch upon really quickly is around sleep, because I've heard that globally, sleep is an epidemic, like lack of sleep is a global epidemic. How can we prioritize sleep more, and how much sleep should we be getting?
Okay, good question. Sleep, I feel like sleep is one of the 5 foundations that I think is really essential, that everybody should not overlook. When we talk about how much sleep is enough sleep, some people might argue with me, I have 6 hours sleep and I feel fresh and I wake up feeling better than ever. But I have a lot of studies that point out that if you sleep 6 hours a night, and after a week, the body feels like you missed 1 night of sleep. Yeah, and the productivity, the brain function decreased as much as you skip 1 night of sleep. So I would say the enough hours sleep is about 7 to 9 hours, depending on your genetic. But if you want to know how much is enough for you, on the day off, on Sunday, go without alarm and turn off, make sure that everything's dark, turn off the light, turn off the TV, turn off the curtain and everything, and just sleep and see what time you wake up naturally. Yeah, and that's pretty much how much hour your body needs.
Not living by a digital alarm clock, but seeing if you wake up naturally without it, how long?
Yeah.
Okay.
Yeah, and I say sleep is really important, not just for hormone health, but for your holistic health.
So how many hours of sleep do you usually get?
8.
8?
Yeah.
Me too.
Yeah, I sleep a lot.
And I'm very proud of that.
Yeah. Yeah, and I'm proud, yes.
So that kind of concludes our talk.
Yeah.
If anyone has any questions.
Hi, so the first question is that, so I've heard from you, and then I've also heard from the last talk that when you go to the doctor, they're always like, get pregnant and your period pain will go away. And I've definitely heard that from the doctor as well. So I'm just wondering, does that mean I have endometriosis as well, or is it just like a more doctor way to like treat pain?
Okay. What did the doctor say?
To get pregnant, so like my pain would go away, which I was like, no.
Okay.
I'd rather have the pain.
I can't say 100% that it's endometriosis because the only way to diagnose it is to look at it through the ultrasound or something through the imaging. But so it makes sense that why the reason that the doctors say get pregnant, everything will be gone, is because when we get pregnant, we have the very high level of progesterone for 9 months. Okay, and what we know is if we have too much of the estrogen, it usually make all the seed or the tumor or any the fiber around the reproductive system to grow. So estrogen will promote the growth. Okay? So if you want to stop the growth, you want to have more of the progesterone. And the way to have a lot of progesterone naturally, getting pregnant. Yeah. So you get natural progesterone for 9 months, and then everything kind of reduces. Yeah. So I can't say exactly it's endometriosis because a lot of stuff like ovarian seed, a lot of stuff, chocolate seed, they're all related to the same hormone imbalance.
I also have another question. Since we were talking about the pills, is there, but for birth control, you would still recommend take the pill, right? Or
Yeah, I'm really against it. I think part of it is I have to take care of a lot of cases that get abused from birth control pill, and I'm very tired of that. So I just want to tell everyone, if you don't have to take it, if you have a chance to get off of it, then just come off. Yeah.
But is this just for the pills or like all the IUDs and everything as well?
Mm-hmm. Yeah, any hormonal IUD or hormonal birth control pill.
Thank you.
You're welcome.
Asking for my daughter because I don't have a period anymore, so no problem. But what's the alternative for a young girl who has a lot of period pain but doesn't have endometriosis? Is it just diet, or what is the alternative? I just want what just to advise her.
So for a girl who have heavy flow, heavy period, and have a lot of pain, I've seen a lot of cases these days with younger, with all the pictures that you showed me. Usually the problem is having too much of the estrogen. So what we call estrogen dominance. So
Yes,
and then
she's
it
estrogen
results in
dominant,
having too much of everything, too much period, too much PMS, too much pain and everything. And part of it, if you think about the lifestyle that we are living right now, we take in a lot of chemical. And when you were younger and now you're compared to this age, we had less chemical back then. So we didn't have as much
I'm
problem.
not that old.
So
You're like 100 years old.
yeah. Or the chicken that we're eating, especially here in Thailand, maybe more than half of it had been treated by hormone. Okay? So we eat a lot of hormone through this and that. Agriculture-wise, I could go really long on this, but it's not just us, but it's everything around us that influence and disrupt the hormones. So I've seen a lot of younger these days having estrogen dominant, and I think that what would likely be.
Yes.
Yeah.
But then what
So-
to do?
So my advice is, if you can get your girl to eat more healthy, if we can select what we cook in our house, so select a better sources of chicken, meat, or vegetable, or if you could go organic, definitely go for it. It's worth every penny, I would say. Use the organic skincare, organic cleaning product, laundry, shampoo, detergent, everything. So if you can get rid of any chemical, then it would benefit all the women in the long run. Yeah. My number one advice, since I don't know the detail yet, but I think that would be number one advice.
Okay, I just had a small question to the last theme, like sleep. Different people need different hours of sleep, and you always read sometimes that you should sleep before midnight, that this is the best sleep. Then other sources say no, it doesn't matter because sleep is sleep. So is there any recommendation, like in general, or is it really like person specific?
Okay. Ideally, when we talk about sleep, definitely if you can go to bed around 9, 10, you get more of the growth hormone. And but a lot of people also argue like, what about I live in different time zone and stuff? As long as I get enough sleep, isn't it enough? A part of it is we have sun and we have moon. We have we have to kind of sync with the environment as well. So if you look at the cortisol production, which is another hormone, it kind of works with the sunlight that comes through. So, and at night when we have no more light, the cortisol hormones start to drop and melatonin started to kick in. So a part of it is we have to sync in with the environmental clock as well, and sync in with our biological clock, so that we would get the most benefit out of the sleep. That would be the ideal. But I feel like sometimes we can't get all those recommended hours. It's kind of unrealistic to go to bed at night every night. So the second best thing to do is get enough hours. And I think another important thing is, if you have certain time that you could go to bed like 12, if you can go to bed at the same time every day, then you would get the same benefit of hormone releasing and everything, because the body kind of know your pattern, your rhythm, and know when to do what, when to releasing certain stuff, and then it would get stable and normal. Yeah.
I have a question.
Sure.
Personally, I was diagnosed with PCOS, and I was told that they didn't know where it came from, what caused it, and that there is no cure. All I can do is control the symptoms. In your opinion, is there a cure? Is there a way to make it go away?
What was the question again?
Like, I was told that there is no cure for PCOS. I'm not sure if it's the same for endometriosis, but is there a cure?
Yeah. Okay. There's yes and no to the answer to the question. Okay. Okay. Sorry. It's a polycystic ovarian syndrome. So what happened is part of it is genetic, definitely. So the genetic is kind of off somewhere, that it influenced you to have the tendency to have the PCOS. But the second part, we can't do anything about genetic, definitely. But what we can do is we can control the hormone balance. We can control our lifestyle. So what I would suggest people to do, PCOS, endometriosis, it's genetic. We never get like a 100% cure from it. Or people with autoimmune diseases, you never get completely recover from autoimmune. It's gonna be there. It's always gonna be there. But what we can do is don't let it affect our quality of life. So I think that would be the main goal. And how do we do that? We have to stabilize the hormone. if we can stabilize the hormone, we're not going to experience, the symptom that you normally get from the textbook when we talk about the PCOS, or the bad acne, the hair fall, the weight gain, the insulin resistance, a lot of seed in the ovary, all those stuff. Yeah. I have a lot of patients who still live with PCOS but don't have any of that. Yeah. So I feel like we can do a lot to stabilize.
Where's your clinic?
My clinic at Sukhumvit 5, but currently I take patient only virtual consultation because of the COVID situation. So I do phone and Zoom visit. Yeah, but you can always come in for the blood test, or we can send the nurse to your house. Either way, yeah.
Well, she has a booth downstairs, so if you want to see her in person, just chase for Dr. Nisha after this talk.
Yeah. Okay. Oh, and I have one more thing for you guys. So I have the quiz about the hormone imbalance. So you can go and do the quiz to test if you're at risk for hormone imbalance or not, and how bad. So it will come with a score, and the score will tell you if you have the mild or moderate or a high risk of hormone imbalance. So check it out.
Where can they find this quiz?
I think we have like the QR code with my staff. Yeah.
So she's passing around the virtual quiz.
And scan, and yeah.
Nisha, can you give us one key takeaway that you would like to give us to wrap up this Body Wisdom Weekend and wrap up our talk?
Okay. I'm really happy that we have this weekend because we get to create that awareness that for all of us to get closer to our body, listen to our body, learn about the body. And I think the key thing is, I'm gonna say the same thing. You are your best doctor of your own. Okay. So make sure you listen to yourself enough, aware of what's going on enough. And then that would be the key success to having a sustainable health and well-being.
Thank you so much, Dr.
You're
Nisha.
welcome.
Tea? What about tea? Oh, so we have Kun Anne's tea, the organic tea that she has a booth downstairs. She would like to serve a sample of everyone's tea right here. What kind of tea do we have this time? So, P. Anne, do you want to give a little description about your calming tea?
So this tea would help you with calming, and also help with the period, to get rid of the bad blood, or dry blood, or if you have like pain from the period, it's good for it. And it's all Thai flowers. It's jasmine and iron chestnut. Indian rose chestnut and bullet wood. Yes. In Thai, I know better in Thai.
The name of the tea?
มะลิพิกุลบุญนาคสารพี แล้วก็เกสรบัวหลวง ค่ะ อันนี้เป็นยาไทย เป็นยาหอม เป็นเบสของยาหอมทุกอันนะคะ ขอบคุณค่ะ